Hi, my name's Louise from Dawn, and today we're going to be looking at Rivaroxaban management using Dawn AC. Now then, the screen that a lot of you are used to is this one here, which is the anticoagulation patient screen, and this is showing us a typical patient on warfarin treatment. So you can see the patient screen. Like I say, I know you're familiar with this, but we can see all of the treatment history down at the bottom with the INR results and the doses, etc. Now, looking at the Rivaroxaban module, the screen will look a little bit different. The screen's going to look a bit like this. And what we've got here is, instead of the history at the bottom, we work from the questionnaire section. And up at the top here, the dosing tab has been replaced and we just have a questionnaires information section. So, the Rivaroxaban module allows you to track whether a patient is, first of all, suitable for the Rivaroxaban treatment, and if they are, to actually move them on to Rivaroxaban therapy and then track them at various intervals, such as 6 monthly or annual intervals as you see fit. So, the module works from questionnaires. We have, first of all, an initiation questionnaire to fill in. So if we have a patient that might be appropriate for Rivaroxaban, we can open up the initiation questionnaire and go through the checkboxes. If they are suitable from that, we can then move them over to Rivaroxaban and we can schedule a follow-up questionnaire for them. So we can see whether the dose of Rivaroxaban is still appropriate for them, and obviously check things like compliance and any issues they're having. The workflow itself is, like I say, based on the questionnaires section. So what we would do is we would stop any existing treatment plan for the patient once we've filled in the questionnaire. If the questionnaire comes out as, okay, the patient's suitable for Rivaroxaban, we would go in, we would stop the existing warfarin treatment plan, and we would start a new one for them. And then we would give them the suitable dose of Rivaroxaban. And then we would schedule a follow-up date for the patient. Now what I'm going to do is I'm going to show you this in Dawn because it's easier to envisage in Dawn. So what you're looking at here is a typical patient screen. This patient's been on warfarin for a little while, and what I'm going to do is I'm going to fill in a Rivaroxaban initiation questionnaire for them. So we're going to see first of all if they're appropriate for that therapy. And to do that, I'm going to go onto the questionnaires tab. I'm going to hit the little new icon here to add in a new questionnaire, and I'm going to choose the Rivaroxaban candidate questionnaire. What I'm on here is the questionnaire form. At the top I have some of the patient details, so I have the patient's name and numbers. I also have a date of completion here as well. I can also, as well as have the date, log the time here as well if I want to. What I can also do is choose where the initiation questionnaire is being completed. So if you have more than one clinic, you can choose the location there as well. Now let's move down a tad. Okay, first question. What's the therapeutic indication for the patient? So these are the list of allowed therapeutic indications for Rivaroxaban. So we need to choose a particular indication here from the drop down. You can see, just as I've chosen that, we do have a little note here, just a reminder to schedule a follow-up questionnaire once we've done this. Then the second question here, okay, if we're switching from VKA, if we're switching from example warfarin, please enter in the current INR. If we do have an INR result in there, we do have a bit of information here at the bottom. It's saying delay starting Rivaroxaban until the INR is less than 3 for this particular indication. Then if I want to pop in some custom notes just in the box here, I can as well. We have entering a start date of the Rivaroxaban or other anticoagulant. So if the INR is bigger than 3 and we want to delay it, we can then put in a suitable start date for when the patient should start the new therapy. Okay. Let's move down. Next thing we've got is the measured creatinine clearance and the eGFR. What we can do is we can use the Cockcroft-Gault estimate here if we don't have these to hand. We can just put these in and click calculate. Okay, so we'll put some values in here to calculate the Cockcroft-Gault estimate. So let's put in 150 and 90 for those values. And if I hit calculate, I'll get my level estimate here. We do have a little note just at the bottom about the limitations of the estimates. If the patient does come out as having severely impaired renal function, this will be flagged up in red, and Dawn will not suggest this patient as a suitable candidate for Rivaroxaban. So if we scroll down a little bit more, we then have a free text field for other tests, so you can just free type in there with any other information you need to. And then moving down a bit, we then have some lists of other information. So for example, contraindicated drugs. Is the patient taking any of these drugs? If they are, if we click on the boxes, you will get a little red flag up here, and Dawn will not suggest this patient as being suitable for Rivaroxaban. I'm just going to untick that for the moment. We then come to interacting drugs. Again, if the patient's taking any interacting drugs, if we check these boxes, what we can see are little red kind of warning messages, and you can click on these icons here just to show us the official guidance for this particular drug and what to do if the patient is taking that. So again, any other anticoagulants or platelet inhibitors, we can check them on here. Again, we do have a little note against those. And scrolling down, any others, again a free text field to fill those in. So then we come to other contraindications. Are there any other reasons or any other states the patient's in? Again, the simple check boxes. If we do check those, then we do have a little red flag, and Dawn won't suggest this patient as being suitable for Rivaroxaban. And then we come to bleeding risks, hemorrhagic risks. Again, simple check boxes on those as well. So moving slightly further down, we have, okay, has the patient got any procedures planned? If they do, free text field for writing that information in. And then we come to who will follow the use of Rivaroxaban. So is it going to be the anticoag clinic? Is it going to be the GP? You can choose that option here. We then have the patient's age, and now we come to our dose options. So Dawn has taken the information I've entered in on the questionnaire, and it's suggesting either 20 milligrams once daily or 15 milligrams once daily for moderate to severe renal impairment as well. So we can choose one or the other depending on what we decide there. You can see we've got a suggested dose here, which is 20 milligrams once daily with the evening meal. Dawn is suggesting, okay, use your clinical judgment before deciding on the most appropriate dose. Okay, from here we can now make our decision, what dose we're going to give the patient. So let's choose the Rivaroxaban 20 mg once daily. Finally, just underneath, I can write in any comments I've got now, any specific comments, again a free text field. Once I'm done and once I've finished my initiation questionnaire, I'm going to click on the mark as complete option here. Okay, and if I close out of that questionnaire now, what I can see is on the questionnaires tab, I can see the summary of my results here. I've got my levels, my details, my Cockcroft Galt estimate. I've also got my suggested dose here as well. So my initiation questionnaire is now filled in, and from this I've decided, okay, the patient is suitable for Rivaroxaban. What I now want to do is go in and start a new treatment plan on Rivaroxaban for them. I'm going to go into the patient's treatment plan up at the top left, just clicking on the treatment plans button, and I'm going to stop this treatment plan that's existing. So the warfarin treatment plan I'm going to stop. Okay. And what I'm going to do is I'm going to click on the new button now because I want to start a new episode for them on the new drug. So again, here I just choose my primary diagnosis. I've got my start date. This is kind of what you're used to here. Duration type. I've also got clinic as well. Moving over though to the right hand side, this is the important bit. Under target range, we choose non-weak here because obviously target range is not appropriate anymore. And then what we're going to do is choose our regime. So what we decided on in the questionnaire was Rivaroxaban 20 mg once daily. Now if you do add a new treatment plan and you choose a different regime to the one that's been suggested within the questionnaire, you will get a big red flag and it won't let you continue. So you will need to choose the correct regime there. Once I've filled in the information I need to here, if I just click on the activate option and just say OK to be, are you sure? I'm going to close out that treatment plan now, and you can see that this screen now looks a bit different. So up at the top, our dosing tab has now been replaced by the Rivaroxaban tab, and I'm working from the questionnaire section just underneath here. Once a patient has been moved to Rivaroxaban therapy, the benefit of having this in Dawn is that as well as seeing the most recent treatment plan with the Rivaroxaban details, we can also look at older treatment plans. So for example, in Joseph's case, we can see his warfarin treatment plan and we can see all his history on warfarin therapy, and then we can flip between the two so we can see the most recent Rivaroxaban treatments and also previous treatments as well. Now, as far as this goes, the patient's now ready. So we have an active treatment plan for Rivaroxaban. You can obviously prescribe what you need to the patient. They can continue. The next thing I might want to do at this point is actually schedule a follow-up for them. Say in 6 months or a year's time, I want to see if the dose is appropriate, if they're having any problems, etc. But to schedule a follow-up questionnaire, all from this tab here, I'm going to click on the blue form icon, and this time I'm going to choose a Rivaroxaban follow-up. I'm going to choose the date that I want them to come back in. So let's say we're going to give them 6 months. Let's go forward 6. Okay, so let's say I want them back next January. Again, I can put in a time if I want to see them at a particular time. It's up to you. But once I'm done with that, once I've put in the date, if I say OK at the bottom of the screen, now you can see we have a Rivaroxaban follow-up questionnaire on here. We can see that the status of that is scheduled, and you can see the date that they're due to come in, the 28th of January. Now what we can do is we can use then the list views to actually find a list of patients that are due for a follow-up. A bit like what you're used to really, we can work from the list views to then work our way down our list of follow-ups for patients. So let's say that it's now January 2014. Joseph has come in for his follow-up appointment. So what I can do is, now he's in here, I can actually click on the follow-up questionnaire itself, and I can go ahead and fill in the details now. I can see that the therapeutic indication is already filled in from the treatment plan, so that's absolutely fine. Now I've got some questions to ask the patient. So, have they taken the correct dose every day? Yes or no? Okay. I might have taken too many capsules or tablets. Have they or not? I might have missed one or more doses. Again, just a yes or no here. If I wanted to enter in some specific notes for this patient, I have a free text field underneath to do that. Moving down, I then have, okay, I've started a new medication recently. So has the patient started on any new meds? Yes or no? We then come to compliance problems. So is the patient having problems taking the medication? And if they are, what are the reasons for that? For example, is the patient living alone, so they're finding it hard to remember? Do they have a lack of information, for example? So again, these are just check boxes to choose, and again, some specific notes just underneath as well for them. Has the patient had any adverse events recently? So have they had any bruising, any bleeding? Again, these are just check boxes to choose. We do have a note just underneath telling us to follow the protocol if there has been any events for actually event reporting, and you can actually click on this icon here to view more detail. Okay, so moving further down, we have our creatinine clearance and EGFR. We do have our Cockcroft Gold estimate to fill in, but this may well have changed since last time we filled this in, so let's check. Okay, so again, I've got my estimate there, so that's fine. Any other blood checks? Again, a free text field, I can pop in what I want in there. And we then come to a lot of other lists, and again, it's a bit like the initiation questionnaire. So, has the patient started on any contraindicated drugs? If they have, we check these. And like the initiation questionnaire, if the patient has started on one of these, it will be flagged up because this patient is no longer suitable for Rivaroxaban. Scrolling down, I've then got interacting drugs. Has the patient started on any since we saw them last? Any other anticoagulants or platelet inhibitors? Any others we can add in? And any other contraindications? Hemorrhagic risks, again to check. Now what we have on the follow-up questionnaire is we have an option for CHADS2 score here and has bled, which we can log as well. So this is just a simple drop down. We can add up our scores for the CHADS2, and then we can tot up our scores for the has bled there as well. Again, scrolling down, does the patient have any procedures planned? And then we have our age, and again we have our suitable doses. If the age is a suitable cutoff, this dose might well be different. Their dose might be changed basically, or Dawn might recommend a dose change. If it's exactly the same, you can see again it's suggesting the same thing, 20 mg once daily. Any other comments we want to log against this visit, we can pop it into the comments field. So once we're done, it's simply a case of clicking as mark as complete there. And once we've done that, if we close out of that questionnaire, we have a Rivaroxaban follow-up and we have the details from that as well. Now following on from that, if we want to see the patient now in 12 months time, just for another follow-up, and all we need to do is go into the icon, choose the follow-up questionnaire and just pop in a different time for them. And once we've got in our new date and hit OK, I've now got another follow-up scheduled for August next year, and they will appear on my list view. So for example, you can see in the list view section here, we have our non-VK list view, and we have a list of patients currently on Rivaroxaban treatment. So we can see a patient here with no scheduled follow-up, we can see a patient with an overdue follow-up, and we can see a patient that's scheduled for follow-up there as well. And again, the beauty of this, like with the other list views, is you can click straight onto the record and go straight into the patient screen from here. So just to recap, all the module works from the questionnaires tab. Using these questionnaires, we have the initiation questionnaire, or the candidate questionnaire, to ascertain whether the patient's a suitable candidate for Rivaroxaban or not. If not, we can just carry on warfarin. If they are, we can create a new treatment plan for them, put them on the correct dose of Rivaroxaban, and then schedule follow-ups as and when we need them. For information, or if you have any questions on the topic we've just covered, please contact us